Hey you guys, welcome back to my channel. I'm Yasha if you're new here, and today we'll be talking about how to choose a medical specialty. This is something that was requested, so I thought I would try my hand at it. There are lots of videos on this subject already, but I think a lot of them focus on kind of the same few things, and I wanted to take a slightly different approach. So hopefully you find it interesting, and yeah, I hope you enjoy. Okay, so let's talk about choosing a medical specialty. I did make a PowerPoint just to help keep me on track and also to maybe lay out some things for you, so it makes it a little bit easier to think about as we go. So the first thing that I think you should do is think about your ideal future. I know that when you're going through your medical school training and you're going through rotations, you're really thinking about like, what rotation do I like best? But I'm trying to encourage you to take a different approach, right? Like, what do you want your future to look like in terms of your work? Because honestly, that could help answer a lot of questions about what you might go into. So in terms of work-life balance, do you want to be someone who's working all the time? Do you want to be the go-to person for something? Or are you okay with more of like a 9 to 5 type of job? Is money the most important thing to you? What are your priorities in that sense? In terms of your in terms of your family, are you planning to have a family? Is that going to affect your work? Because I know that the answer to those two questions can be different for people, right? Even if you are planning to have a family, you don't want it to affect your work. So those are other things to consider. And of course, what hours do you really want to be working? What about weekends? Do you want to be the first person at work and the last person to leave, or are you more looking for a part-time option? And then there are things like call schedules. Different specialties have different call schedules, how often you're supposed to be at the hospital, how often you're on call, depending on how big your group is. Do you like shift work? Do you like the idea of shift work? Do you like the idea of going to work and then coming home and not having to deal with anything at work? So those are all things that you should think about. And then of course, the in-house call versus the home call. I mean, do you want to be in the hospital for 24 hours or would you rather take a pager call? And then obviously the length of training. So training can go anywhere from 3 years all the way up to, 6, 7, even more years. So that can be something that you think about too. And I just want to encourage you to think about these things because sometimes I think in med school, we're kind of discouraged from thinking about this. We're discouraged from like wanting work-life balance. We're always talking about how like more is more. And I really think that's unhealthy. And it really makes more sense to think about these things when you still have the option to go into a different specialty, but instead of, thinking about it later and wishing that you had made a different decision. So really think about these things strongly, think critically. Obviously, the specialty you go into has to be something that you love, but you also want to make sure it's conducive to the life that you want to live. So just some things to consider. The next thing to think about are the first 2 years. So depending on where you are in your medical training, you might already have gone through this, or you might be in the thick of it right now. And really think about the things that you liked, even in your preclinical training. I know it's easy to kind of put off these decisions until you're in your third year, but really think about the first 2 years too, because things like anatomy, physiology, pharmacology, immunology path, like these are all things that can sort of affect how you go about deciding a specialty. So I just put some examples here. These are not all inclusive by any means, right? Like anatomy is not only in radiology and surgical subspecialties, but this is just more of broad generalization of things that I thought about too. I really liked I liked radiology. I do really like radiology, but I really liked anatomy. For me, it came easily. I found it easy to study. I enjoyed studying it. Didn't feel like a drag. Whereas like pharmacology and immunology, I was more like, oh my God, how am I supposed to remember all of these things? Even physio, I found like cardiopulm to be hard for me. So just things to think about. What comes easily to you? What do you enjoy studying? Because those are the things that you're going to enjoy in your future too. That can at least help rule in or rule out some specialties for you, or at least get you thinking in that mindset. Obviously, think about your rotations, what you like, what you don't, but don't just think of the rotation as a whole. Like, don't just think of all of internal medicine and think I didn't like it. Think about what you did or what you didn't like. So, for example, for me, internal medicine, I did not enjoy rounding. I found that to be really, really, I don't know, like I just found it to be stressful for me. I found the pimping, I did not enjoy that. I didn't like how long it took. I didn't like having to take the stairs all the way up to 8th floor. Like the whole experience for me was just kind of negative. But I didn't hate every part of it, right? Like some people really hate writing notes. I don't think I really minded the note taking part of it, but there are pieces of rotations that you're going to like and pieces that you don't like. So just remember that it's not just all, I hate all of this rotation, which means that you can't do it, but think about the things that you did or didn't like specifically within that rotation. What made the experience good or bad? And that includes your colleagues. That really includes the people that you're working with. What are your attendings like? Like, I mean, I don't want to hate on surgery, but surgeons are known to be a little bit kind of abrasive. They're known to be more of the pimp style. Like, they really like to pimp you. They're tough on you. And if you like that culture, then that's maybe something that you might gravitate towards. But for me, that really made me not want to go into it. It is true that there are certain types of people that are attracted to certain types of certain specialties. So think about those things when you're choosing, because these are who your colleagues will be in the future. Aside from that, think about, the clinical setting. So something I want you to remember as you are thinking about what specialty to choose is that within one specialty, there are so many ways to practice that specialty. Take internal medicine, for example. You can be doing hospitalist where you're working on the floors, right? You could be purely outpatient doing primary care. You could go into a subspecialty where you're a specialist now. You could be in the ICU all the time as a pulmonary critical care doctor. And these are all different clinical settings, So you have to remember that just one, the whole specialty is not defined. It's not one thing. And sometimes as a med student, you don't get to actually rotate through all of these various things, but you do need to, in order to make an educated decision, you need to think about all of that before you choose what specialty you're going into. And then, of course, patient populations. Do you like pediatrics? Do you like working with women? Do you want to take care of more like male-oriented stuff, like urology, for example? Think about these things. What populations do you gravitate towards? Geriatric, that's another, is that something that you enjoy? Chronically ill patients, patients that are otherwise relatively healthy. These are all things to think about. You also want to think about the hours that you're working on the rotations. Like, I didn't really enjoy waking up super early for surgery. I didn't really enjoy getting paged like 3:30 in the morning for surgery. Like I said, rounding, not really my thing. What setting you want to be in. So the OR, I didn't mention that yet, but that's another area where that's kind of a specific thing. If you want to be in the OR, then you need to go into a specialty where you will be in the OR more often. Note and history taking style, medicine is much different than surgery in the note taking and the history taking part of it. So which one do you enjoy? Which one do you gravitate towards? And again, these are not exclusive. Like, you can be someone who takes a very thorough history and still be a surgeon, right? Like, those are not mutually exclusive, but again, all I want you to do is think about these things, because this whole video is about choosing a specialty, and these are things that you want to think about because this is your future, and these are the things that you will be doing as a physician in whatever specialty you decide. And then, of course, the colleagues and culture, like I said. The next thing I want you to think about are the patient populations. Keep an open mind. What does that mean? If you want to work with children, people are going to be like, you should do pediatrics, right? And that's good and that's valid, but I also want you to remember that there is a pediatric subspecialty of basically everything that exists. Radiology, pediatric anesthesia, pediatric surgery, pediatric ENT, there's child and adolescent psychiatry, there's pediatric derm, there's pediatric ophthalmology, there's pediatric everything. So working with children is something that you want to do. You're really interested in, working with children because they're otherwise relatively healthy and you really enjoy working with that population. You like seeing them grow up. Don't just box yourself into pediatrics, but keep an open mind. Think about what it is you want to do in your specialty. Do you want to do surgery? Do you want to do procedures? Are you more interested in anesthesia, for example? Just think about that, because you can still tailor your career to the patient population that you like and you want to work with, even if you don't go into pediatrics, for example. The same thing goes for women. The same thing goes for a lot of different patient populations that are very specific. There are a lot of ways to get involved with that specific patient population without just going into the kind of stereotypical OBGYN for women. There's lots of ways to really get involved in women's health, breast pathology, breast surgery, women's psychiatry, women's imaging, of course, my favorite, what I'm going into. So just keep an open mind and don't forget that every specialty has a subspecialty, and you might be able to find, what you're looking for through a different specialty. That's not just the stereotypical one that people tell you to go into if you want to work with a specific population. I also think thinking about procedures is important, because depending on what you're interested in, you're obviously going to get a lot or zero of any surgery or procedures if that's what you want to do in your future. I wrote that, remember that there is a spectrum. This is a spectrum. You can be someone who is a surgeon. You are a surgeon and you're doing surgery every single day of the week. versus people that don't want to have anything to do with that. You don't want to be in the OR, you don't even want to be in the hospital, and you might want to be totally separate. And then there are the people that are in between. And remember that there are a lot of specialties that are in between. Things like ICU, problem critical care, they're doing central lines, they're doing ABG, they're doing arterial lines, lots of stuff on the floors. And of course, this also depends on where you work, because which hospital and institution you work at might have a central line team, they might have a PIC team, and you don't even know who's on that team. Is it just anesthesia? Is it problem critical care? Is it, I don't know, any host of different types of physicians, and you don't know who's on that team, and it really is institution specific. So don't just like cross out a specialty because you think that you're not going to get what you want out of it. Make sure you do your homework before you do that. If you don't want to do any procedures or any surgery, like I do not want to go to the OR, that is not my place. So I chose radiology, but I still like doing some procedures. So I chose a radiology subspecialty where I can do that. And then of course, interventional radiology, OBGYN, these are also procedure heavy specialties. OBGYN is literally surgery. So you're going to be in the OR. IR, you'll be in an IR suite. So if you like the procedure thing, but you maybe don't want to be actually in the operating room, that's another option for you. Just remember that there is a spectrum. There are so many ways to get involved with the things that you like, and it doesn't just have to be surgery or not surgery. There is an in-between. And then of course, the clinical setting. So if you want to do primarily outpatient, then that's maybe you want to do primary care. There are some surgery subspecialties that primarily work on an outpatient basis in outpatient surgery centers. So that's again, something to keep in mind. Of course, during optho, and then there are some radiology offices that are totally outpatient, and you just have to find those and think about that and shadow the appropriate people. In terms of working on the floors, of course, you're any sort of hospitalist, so medicine, peds, even OB, of course, ICU will be critical care, pediatric critical care, neurocritical care. Remember that there are lots of, like, neurology is something I haven't really talked a lot about, but they're on the floors a lot of the time. So just remember these things. And just because, like, in your mind, you're thinking medicine, pediatric surgery, kind of like as those OBGYN, there are lots of other specialties that kind of overlap. And so you just have to keep a very open mind when it comes to choosing a specialty. If you like the ER, then maybe EM or trauma surgery could be a good place for you. And then of course there's in the hospital, but not on the floors, which is kind of where I am, radiology, pathology. There are probably others and I'm just not thinking about it, to be honest. I can't remember, but just remember that there is a variety. There is a lot of ways to tailor your career, and it's not just black and white. And if you choose internal medicine, you are stuck doing only outpatient primary care. It's just not like that. So just keep an open mind, but think about the clinical setting and think about what it is that you want to do. Like, a radiologist is not going to be doing an outpatient primary care clinic, right? That's just not what we do. So if there is something specific you're looking for, make sure you remember that when it comes down to like where you're going to apply, what you're going to apply for. Aha, work-life balance, one of my favorites. So obviously every career can be tailored. You can be a part-time surgeon. You can be a part-time interventional radiologist. I wouldn't stress too much about it, but there are some specialties where this is more common and more easily done than others. So that's just something to remember too. Working more often or more call. I wrote down surgery, IR, OB. Think about people that are kind of always on call and whether they're going to be in-house or not in-house, things that come up. Like IR is kind of like a, I don't want to say a dumping ground, but a lot of times it is for procedures that need to get done after hours, for procedures that other specialties don't want to do. And they come in at any time. GI bleeds come in at any time. Same with surgery. Appendicitis happens at any time. OB, people go into labor all of the time. There is no time when you can clock out and be done. Shift work. If you like shift work, for me, that's something that I actually do like. I like being able to go to work at 7:30 and leave at 5 and, you know, plus or minus 15 minutes here and there. But I know that if I get paged at 5:05, there is someone there that's going to help me handle it. So emergency medicine, radiology. I honestly don't know how pathology works, so I put it as a question mark, but maybe someone can comment and tell me how it really works. And then of course, if you want to do office hours, holidays off, weekends off, that type of thing, outpatient might be the way for you to go. So just some more things that might help you make your decision, but don't stress because every career can be tailored to what it is you're looking for. And remember that life changes. What you want today may not be what you want in 10 years because your life has changed in some way. Maybe you did decide to have children. Maybe you decided you didn't want to have children. It's okay. And you are going to be able to tailor your career in a way that works for you, no matter what you go into, as long as, you know, you use your voice and you advocate for yourself. I don't really see this being talked about a lot. And I think it's important to remember that a lot of specialties and subspecialties come with a lot of emotional stress, more than others, I would say. Some more than others. Um, Heme-onc, heme-onc really comes with a lot of emotional stress, and a lot of people gravitate towards this. So if this is you, I mean, this is a great specialty for you. Some people would find this very traumatizing and may not be able to separate their work and their life in a way that's healthy for them. Trauma, I mean, you will see some very crazy stuff, psychiatry, and even some pediatrics, depending on where you're working and what type of population that you have in your community. And these are, again, just some of the specialties, but I would say these are some of the most, I don't know, like, I don't want to say traumatizing, but definitely the most stressful in terms of how it's going to affect you and your life. You become close with your patients. You want them to be healthy. You want to help them. And then there are some times when you just can't. And that can really wear on your mind over time. And so if that's something that you enjoy and you like working with those types of patients where you can really build that long-term connection and you become their partner in their journey, then maybe this is something, heme-onc might be something that's good for you. But if you know that you're someone who that will affect in a negative way and you won't be able to help people as optimally as you otherwise could, then maybe you want to stay away from these specialties. But that's just something else to consider that I really don't see a lot of people talking about. And I think it's really, really, really important. You may not even get a huge experience of that in medical school, but think about it when you're choosing a specialty. I think it's really important. Where in the healthcare cycle do you want to be? This is another thing you can kind of think about when you're thinking about what specialty you want to choose. Do you want to be at the very, front door of healthcare? So primary care, if someone needs an appointment, you are the first person that they are going to see. You might be the first person to catch something that they have. That is probably primary care. So peds and internal medicine would probably be the two main things that I'm thinking of. Family medicine. I should also include family medicine. See, I just remember that I haven't included family in any of this, but family is also a very important specialty to consider if you are thinking about primary care. Do you want to be a specialist? Do you want to be someone who only gets referred patients from, primary care doctors? So any sort of subspecialty from IM, rheumatology, who else? Rheumatology, hematology, oncology, any sort of medicine subspecialty, allergy, immunology, and then of course, derm, ophtho, surgery. Usually surgery has to have a referral. You need something removed. You need to go see a surgeon. Do you want to be someone who's more of a catch-all? So you're going to help anyone that comes through the door. And, classically we think of emergency medicine and trauma surgery, but also remember that radiology and pathology, I'm not waiting for someone to have a referral. Well, in breast radiology, yes, you do have people that come in more as a specialty clinic, but in terms of our day-to-day work, I'm helping anyone that comes into the ER, anyone that's admitted, I'm reading their imaging. So I'm not choosing to see patients based on insurance or something like that. I will read whatever imaging that shows up on my list. And same for pathology. I mean, they're going to be doing whatever pathology that needs to be done from the hospital that day, from surgery, et cetera. So that's another way to kind of think about medical specialties. And then of course, if you want to be someone who doesn't take any insurance, you want to be only elective, maybe something like plastic surgery or even some dermatology might be the right avenue for you. So think about where you want to be in the healthcare cycle. Do you want to be the very beginning, middle, end, or kind of anywhere in between? And just as a summary, things to remember. So every specialty has subspecialties. You don't get to rotate through all of them as a medical student. You're probably not even going to see half of them as a medical student. You probably have to choose one or two that you're most interested in to see. But remember that every career can be tailored. And if you choose to do something and you decide, oh, I want to actually work with a specific type of patient or something, then you can probably subspecialize in a way that helps you see that specific patient population or tailor your schedule in a certain way, et cetera. So don't fret too much. And remember that everything is variable, and everyone's career in internal medicine, for example, is different. Even if they are two hospitalists, they might have different schedules. They might have different ways of working. They might have a different outpatient schedule, for example. So just remember that things can be tailored to whatever it is you're looking for, and not every specialist or subspecialist in one specialty is the same. You have to do your homework on all of these subspecialties before you choose or exclude a specialty. So, I mean, obviously I know radiology the best, and I would say that, first of all, most med students don't even rotate through radiology, and even for those that do rotate through radiology, most of them don't even go through any of the subspecialties, or maybe not more than one or two. And many of them don't even know that we have subspecialties. And so make sure you do your homework on every specialty or subspecialty that you're going through and see like, what are my career options with this specialty? I mean, think of it just like when you're in high school taking a career quiz. Think about it that way, because radiology is easy to lump into one thing, but each specialty is very different. And I'm guessing the same is true for OB. I mean, reproductive endocrinology is much different than hospitalist OB, right? So just make sure that you are thinking about each subspecialty as its own career choice, because that's really what it is. It's a different career altogether. As I said, most careers can be tailored to fit your needs. And make sure that you are able to handle the bread and butter of your specialty. So if you hate delivering babies, then maybe don't go into OBGYN. I don't know. Like maybe you are really interested in gynecology and you're willing to put up with the obstetrics part of it. But same with radiology. Like if you're not willing to do the body CT and those types of things, then maybe radiology isn't a great fit for you. And I mean, it goes for everything, right? If you don't want to see CHF and COPD exacerbations, then maybe don't go into internal medicine, right? So think about the bread and butter, make sure that it's something that you are able to handle and that you enjoy doing, or at least you can kind of tolerate it, because especially during your residency, that's probably all you're going to be doing. And you may have to do some component of that even during your career. Just depends where you work, what your group looks like, what your career looks like, etc. But anyways, I hope this was helpful for you. I tried to give it a different spin than all of the other videos I've seen that exist on YouTube. It's not just about the money. It's not just about, certain things, but remember that it's very flexible. Medicine is not just one thing. And it's important to keep that in mind when you're choosing a specialty. And you know where to find me, at Yasha Gupta MD on Twitter and on Instagram. And I will see you in the next one. Bye.